Hello, my name's Anna Hallas and I work for Compass Group in the healthcare division as the National Domestic Manager and Infection Control Lead. We adopted UVC technology when it first came out many years ago, and we really like the technology because it delivers decontamination, but it does it at the same time as meeting the Trust's agenda for speedy turnaround of rooms. So we can sort of both quickly decontaminate and make sure that we've got the right level of decontamination. So, and it's also easy for our teams to use. It's an easy system to operate. So it meets lots of different agendas for us. Environmental contamination has become a real issue, and there's lots of research that shows that patients could effectively get the infection based on the previous patient. So we want to make sure we can decontaminate areas to keep patients safe. And with infection control becoming more complex, multi-drug resistant organisms becoming more prevalent, it was very important that we make sure we've got the right UVC kit to do that. So we use a mixture of HPV and UVC to create decontamination to make the environment safe for our patients. There's many different companies who have developed UVC, and for us, we want to make sure that it provides assurance that all areas have achieved decontamination within an area, within a confined area that we're trying to decontaminate. So obviously, we want to make sure it's safe. So it has to be within the confines of a room or an area. Some systems advocate using curtains. We wouldn't do that. So safety is our number one priority. And then we want to make sure that we can provide assurance that every cycle has achieved decontamination. And we like the systems that actually provide that and provide us with reports that detail the level of decontamination that's occurred in each and every cycle. That helps us to provide assurance to our clients and trusts, and we know that then we've got assurance that the area is going to be safe for patients to be housed in. UVC's developed over a long number of years, and actually it's come an awful long way. We like the Finsentech system. It's simple and easy for our operators to use, using an iPad to help you to be able to scope out the size and dimensions of a room to make sure it's achieved decontamination. And we like the expandable nature of the tool as well, so that we know that it's not just getting to the low level surfaces, but also it's achieving decontamination in areas that perhaps a bit like Heineken, in areas that other decontamination systems can't reach. We've had a good experience. Kebamed, who actually we buy the kit from, have been very good and very helpful and very responsive to our various needs. So we can do trialing and testing to make sure it works in every environment, because not all our environments are the same. And that's been very, very helpful. And obviously we know from working with Finston that we've got all the backup testing that's all properly accredited. So we know we've got assurance from that perspective as well. So it's been a good partnership.